during that time, lot of people were also indoors, so the infection was kind of controlled, because you see, this infection is also spreads when you are going into crowded places, when there are a lot of people around you. So that is again a source why this infection can spread. So now that people have started coming out, when the COVID is gone now after 2 years, so we see that there's an increase and rise of spurt in these cases.
Right. Dr. Chaudhary, I also want to ask you something that, COVID did one very good thing for all of us. It actually made us very conscious of certain facts, that look, you're not going to get COVID because of this, you're going to get COVID because of the breath, you have to wash your hands, you have to see that the spaces, the surfaces are clean, don't go out and maintain social distancing. But I'm going to tell you something, I have met people who said, and I'm laughing because I think you'll also smile when I tell you the reason, wearing dark glasses. And I said, what happened? He said, pata nahi, 2 din se aankh aayi hai. I said, acha, to aap aaye kyun kaam pe? So they said, nahi, I am wearing dark glasses, this is fine, it's only when I look at you, aankhon se aankhein milane se hi badhta hai. So I said, aankhon se aankhein milane se ishq hota hai, conjunctivitis nahi hota hai, so I was laughing about it. Look at it. People still do not know that it is not because I'm looking at you and I have red eyes that the others will get it. Please explode these myths for the viewers as to how is this spread, Dr. Chaudhary.
See, it is very important and imperative to understand that this infection, it spreads something like COVID. So during COVID time, like we used to tell all our patients that avoid touching your nose and mouth, because usually these infections, these viral infections, they spread to a fomite route. What does that mean? That somebody has an infection in their eyes. Now suppose they touch their eyes with their fingers, and now they are touching some other surface, and then somebody, if that person is touching those surfaces and then touching his eyes, then the infection gets spread. Similarly, if somebody has eye flu and he touches his eyes and then he's shaking hands and maybe touching things around in the house, and all those other family members are touching those surfaces and they're touching their eyes, so the infection can spread. So the most important thing that we tell all our patients is that you should avoid touching your eyes. This is the most important step to be followed. Plus, also we recommend that at times you can wear 0 number glasses. So these glasses kind of become a barrier to your eyes. So suppose inadvertently your fingertips are going towards your eyes, so you have a barrier which takes care of that. But yes, this myth has to be cleared that it does not spread by looking at other patients' eye who has viral conjunctivitis. So this is, I think, the most important myth that needs to be cleared, because most of the time people have these phobias that if we look at somebody's eyes, a red eye person, that infection can spread to their eyes just by the route of air. That does not happen.
Dr. Anita Sethi, who's Director and Head of Ophthalmology, Fortis Hospital, Gurugram, has also joined us. Dr. Sethi, lovely to have you. Dr. Sethi, I want to ask you, considering that you see a lot of other cases as well, there is a fear that people who have, let us say, cataract, or advanced stage of cataract haven't yet got operated because, doctors say that cataract, let it be for some time, and then we'll operate, or they have glaucoma or autoimmune disease like VKH and, these kind of diseases. Are they more prone to conjunctivitis, or that's also a complete myth because there is paranoia? In our country, as you well know, cataract and glaucoma and also other kinds of eye diseases because of diabetes is high. So I'm asking you that are they more vulnerable, or that is not true?
No, thanks for having me here. No, that is not true at all. I think, as Dr. Rahil has already said, that this is a seasonal infection and is more likely to be spread in crowded places. So yes, if you look at it from this point, that those who have elderly people will come to a hospital, they may be more prone to pick up other infections, including eye flu and conjunctivitis. From that point of view, those who are older, diabetics, who are visiting the hospital for other reasons, they may be a little bit more prone. But really, it is spread in the crowded areas, the schools, the colleges, offices. So it is, again, spread by the secretions. So it's just most important that those who have the disease shouldn't touch their eyes. And in fact, the prevention is also to not touch your eyes and the frequent use of hand sanitizers. So other than maybe diabetics who are prone to more infections anyway, those who have dry eye, those who are contact lens wearers, they may be a little bit more prone to pick up any infection, including this. So the contact lens wearers, the patients of dry eye, they may need to be a little bit more careful they may be a little bit more prone.
Right. Dr. Chaudhary, what is the difference between pink flu, people are calling it also pink flu, and, conjunctivitis? Are they the same kind of an ailment, or there is a difference?
Well, I haven't heard of pink flu before, but I think most probably there are different names of the same problem.
Right.
So, viral conjunctivitis is also known as eye flu. It's also called pink eye or red eye at times. And sometimes it is also referred to as aankh mein dukhni aana ya aankh aana. So, these are multiple names for the same problem. But you see, what is important to understand here is that there can be 100 reasons that the eyes can get red. Now, are you having viral conjunctivitis, or is it some other problem that the eyes have become red? That needs to be checked. Because usually what we are seeing nowadays is that when patients are having these red eyes, and now they are hearing so much about eye flu and news and other places. So generally patients, what they're doing is that they are visiting some local pharmacy or drugstore.
Hanji.
And they're usually asking the pharmacy guy that I've got eye flu, prescribe me some medicine. And 99% of the cases, the pharmacy guy is giving him an antibiotic and steroid combination, something like a moxifloxacin and dexamethasone combination. And this becomes a problem because in early stages of this disease, steroid drops are usually not recommended because steroids can increase the disease and cause more viral shedding and delay the healing process of the eye. So this is becoming a concern for us that people are self-medicating themselves and they are getting into bigger troubles. Suppose they don't do this and visit a doctor, then otherwise this problem can go away in about 10 to 15 days. It's a mild problem usually, and it is usually self-limiting.
Dr. Chaudhary, I will come to you about the duration later, but Dr. Sethi, let me bring you in here. Dr. Sethi, the other thing, I do not know whether it's paranoia or we are being extra careful, but for instance, my colleagues, a lot of them are also down, okay, with conjunctivitis. 4 of them have told me that they have had it when they were children. It would stay for 4 days. On the 5th day, there will be a bit of redness. On the 6th, it disappears. This time around, they say it's staying for a longer time. So do you think that that is, I'll tell you why, because after COVID, we've all become kind of slightly scared, कि पता नहीं कौन सा variant है, पता नहीं कहाँ से आ गया, we're all very scared of this. So please talk a bit about that to the viewers, about whether it stays for a fortnight, because someone I know and my colleague has been off work for almost 7 days now.
This time it is a little longer. In usual years, the conjunctivitis is 5 to 7 days. This time it is a little longer. And really, it is milder in children. So when your colleagues were children, they would have had the milder variant. And as we become adults, somehow we seem to get it a little bit more severely. We don't know which variant it is. And now, of course, people are working on trying to figure out. It's usually adenovirus at this time. And we don't know for sure how much different it is from the previous years, but definitely this year it is 7 to 10 days, it is lasting. And the important part to know is that it is infectious for as long as you're having watery eyes. So usually after 7 days, you might still be having a little discomfort, but the eyes will stop watering and it is then not infective and you could come back to work. But some patients it is going on for 2 weeks, so it's a little difficult to say. Definitely children it's milder, and in adults it's a little longer. But it's important to know that this is not a severe eye disease. It is not going to cause any lasting complications in most of the patients. So you just have to take symptomatic relief take the eye drops, and it is going to get better, maybe 7 days, maybe 10 days. The problem is when people over medicate, or they don't see a doctor, and the few patients who might develop corneal complications, if they don't see a doctor, that can be a problem. So it is best to see a doctor, get prescribed, and you will be well in 7 to 10 days. It's not scary, and I don't think it's in any way related to COVID. So it is just the normal seasonal infection, maybe a little more severe this time, more patients, more infectious, and a little severe in just a very few number of patients.
Right, and even as Dr. Sethi spoke about more cases, let me also bring you up to speed for those who've just joined us on this broadcast. 1,521 conjunctivitis cases pan-India. Doctors are witnessing average 100 cases every day in Delhi. That's the statistic. And also private eye care hospitals in Delhi reported 1,032 cases both in Delhi as well as NCR. Mumbai has seen a surge of 20% spike in conjunctivitis cases, exactly what Dr. Sethi was saying. Chandigarh GMS at 16 reported 1,186 eye flu cases in a week. Spurt of eye flu cases reported in several parts of Agra, and flooded Ambala has also reported around 1,225 cases since 13th of July, and reported 90 conjunctivitis cases on Tuesday alone. So that's pretty much the lay of the land, as it were, and I showed you those statistics only because Dr. Sethi was saying that how more cases are now coming to the fore. Let me go to Dr. Chaudhary. Dr. Chaudhary, I want to ask you something, is that I have seen a lot of cases at work, and even a lot of them have got it from their kids who went to school. They said my daughter or son had it and I caught it. But they are coming to work every day. It's not like they are taking a single day off. Is that proper? Because I panicked. I said, "Arey, aankh khai hui, aap log kyun aaye ho?" Now you do understand that certain tasks or skills you have, like makeup men. I mean, we have to apply makeup when we are in television. So his hand goes all over. So I'm scared of that. But as journalist, if you're just typing on your own keyboard, or if if you're doing other functions like that, does it matter, or you think, Dr. Chaudhary, they should stay home for a couple of days, sir?
Yes, it does matter, and that is why usually we recommend adults who are having this infection to take off from their work for about 4 to 5 days. So the initial 4 to 5 days are the infective phases, when the infection can spread from one person to another. So usually people going to offices, they will have other people around them. And even if you take all the precautions, you cannot eliminate 100% the risk of spread of infections. So usually for adults, we recommend that you start taking treatment. And in the initial phases of this problem, you also could have a lot of watering, lot of irritation, itching, and maybe photophobia, sensitivity to light. So all of those things can also be taken care of if you take 3-4 days off, be at home for some time, do your symptomatic treatments, do the treatment that doctor prescribed you, and let the infectious phase of the disease go away, and then you're good to join back all your routines. And especially with children who are school going children, for them the recommendation is that you should take about 2 weeks off, because children are usually careless about these things. They would not wear the dark goggles, they would not stop touching their eyes, and usually they are fidgety about these things. And especially the eye being red, they can also be bullied by some of the other children. So for children, it is recommended that you should take about 2 weeks off from your routine, off from school, and for adults 5 days is good to go.
Right. Dr. Sethi, the thing is that Dr. Rahul Chaudhary spoke about, medication and steroids being given. He said it is not, advisable at all. But you know what? Again, this is again a rumor. Oh, there are no medicines for conjunctivitis in Delhi and NCR. सब कुछ खत्म हो गए हैं. आप लोग खरीद के रख लो. ज़रूरत हो सकती है. You know that panic which is created amongst people as if that's the end of everything. So I want to ask you, A, is it important for someone who's got this infection to immediately see a doctor, or you think because a lot of them say that we can't go, I mean it's our timings are not suitable, they are doing video calls, or actually video calls are also okay, they are doing phone calls, they are going to pharmacists and saying dawai likh do. Tell me how important it is to visit a certified doctor who can sit you down and tell you the entire process.
I think it's very important to see the doctor because there are chances in some cases where it's very severe and there can be corneal involvement. So yes, I mean, if it's absolutely not possible, then at least a video call or a video consult. But I think it's important to see the doctor and be prescribed the correct medication. The medication is very simple eye drops and there is no question of it finishing up. So that is really, I think, just unnecessary panic. We are only prescribing lubricating drops and antibiotics, simple antibiotic drops. In a very few subset of severe cases, we may need to give some anti-inflammatory, some dilute steroids, but that unless we see the patient, we just can't advise that. So yes, I do believe that even though there is a risk of your spreading the infection, but you should still see the doctor to confirm the diagnosis, because as Dr. Rahil said, there are other cases of red eye and we don't want to be missing out on something else. So we must confirm the diagnosis, start the treatment and explain to the patient how the disease is going to spread and how it is going to stop, and so that they're just well educated and aware, and we prevent the panic and we prevent the spread like that.
Sure. Now, Dr. Rahil Chaudhary, I want you to tell the viewers as to how do you protect yourself from a patient who comes visiting you and has conjunctivitis. What do you have to do around a patient or around someone who has, if my colleague has conjunctivitis, what I am doing is I'm paranoid, so I kind of keep hand sanitizing, and I, because I'm scared. I mean, I feel it's a profession where I have to be on camera, so I can't possibly have an eye infection. No one should have it, God forbid. But tell me, how do you, Dr. Rahil Chaudhary, what would you say are this 1, 2, 3, 4 pointers to protect yourself from not getting the infection?
So, let us take an example that there are some eye flu people around you, and how do you protect yourself, and what does the eye flu patient has to do so that the disease is treated faster and he gets relief from that. So number one, the first thing that we tell everybody is don't touch your eyes, because you have to understand that this infection spreads to fomites. And those viral infections can be on any surface, on the table, on the door handles, on the bathroom handles. So avoid touching your eyes, because there's so many times the infection can be on your fingertips and that can be spread to your eyes. Number two, you can wear a zero powered glasses. So this is a barrier so that in case accidentally your fingertips are going towards your eyes, so you have something to stop them. Number three, all the surfaces preferably should be sanitized with sodium hypochlorite. So it is readily available. So that also gives you an added cover. Also, sometimes what I see people is that they see people around them having eye flu. So as a preventive measure, they start putting antibiotic drops in their eyes.
Yes.
So again, we have to understand that this problem is a virus infection. It's a viral problem. And antibiotic drops are only given to prevent secondary infections, because once you have virus on your eyes become more susceptible to catching secondary infections. So putting antibiotic drops just like that would not help you. Rather, it would cause more harm, because then your body can become resistant to those antibiotic molecules. And then when you actually need them, the medicine doesn't work. Plus, also, I see a lot of time people, they keep washing their eyes with cold water. Like you were displaying some images here also when we were talking.
Yeah.
So there were a lot of people who were just splashing water onto their eyes.
Right.
And somewhere people have heard that eye hygiene is very important in eye flu. So they keep washing thinking that the eyes would stay clean. So that is a very bad habit, because you see what happens is that once you have this eye flu on your eyes, your the immune status of your eye is low, and you are at a risk of catching other infections. And usually the water supply in our country can be contaminated at times, and that infection can then go to your eyes. So washing your eyes with tap water, absolutely not recommended. Plus, also, I see that when we tell patients to keep eye hygiene, usually what they're doing is that they're using their handkerchief or rumal or maybe a
Yeah.
piece of cloth and they keep cleaning their eyes, and then they keep that cloth piece with them, or the handkerchief with them. And then they're using it for one eye, then they're using it for other eye. So in these cases, the infection can spread from one eye to other eye. So for that, we usually recommend that you should use disposable tissue paper. So you clean your eyes, and then the tissue paper has to be discarded. It doesn't have to be kept with you. And then you take a new tissue paper, clean your eyes with that, and then discard it.
Right.
So these precautions are important, and you can just pass out this phase.
Right. Dr. Sethi, you know what Dr. Rahil Chaudhary was saying right now, and I want you to elaborate on this. In conjunctivitis, the eyes stick to each other. When suppose you've slept off in the morning, वो आँखें चिपकी हुई होती हैं. So I guess for that people actually splash water, you know, and also I think most of us wash our faces in the morning. I mean, you know, so particularly when the eyes are stuck, I saw someone recently said, my eyelid is stuck to my eye. How do I open my eye? So he I mean, of course, you get tissues, particularly for the eyes, which you nichod ke, you know, you can, they are very expensive, those eye tissues that you get, particularly for cataract patients after, you know, the operation. So I'm asking you this, that what do you do then? I mean, how do you deal with sticky eyes, ma'am? How do you open your eyes?
I think Dr. Rahil has really described all the points. I would really like to highlight that the use of cloths or hankies is really to be avoided, because the virus will stay in those cloth and those hankies. So yes, tissues. Now in the morning, coming to your question, you know, boiled water and cotton, you know, ghar wala boiled water and cotton, and maybe with a pinch of, you know, meetha soda, baking soda, you know, you can just use that, and closed eyes, you just gently clean the eyes, so that the sticky, whatever has got stuck, just becomes liquefied, and then you can just wipe it away. So tissues don't work as well for that, because the tissue scrapes the eyelid. So the morning problem is best solved with, if you do have boiled water, that's really good, or just water and cotton with the closed eye. I think the splashing of the open eye is what can give rise to other infections. But to unstick the eye, you can use the boiled water or just some clean water and cotton, and very gently dissolve the you know, the stickiness or the, you know, the crusts that are there, and they will gently flow away. You don't have to rub it very hard. Don't, you know, ragdo it, because you will cause some injury. Just gently wipe it away. It will get wiped. And a pinch of baking soda or a pinch of boric powder is a little antiseptic, as are some of the wipes which have tea tree oil, and they can be, those who have a severe infection, the secretion cause the whole eyelid skin to become very dry, very uncomfortable. Sometimes I've seen people get cracks in their, you know, eyelid skin, extremely painful. In those cases, you might need to use the tea tree oil or maybe a little bit of coconut oil away from the eyes, just to make the eyelid skin a little better.
All right, what a wonderful discussion and very timely indeed. Let me thank both of you. Dr. Rahil Chaudhary, thank you very much. Dr. Anita Sethi, it was a sheer pleasure. Thank you very much. And for those who watched the show, like the doctor said, there are several ways to actually keep your eyes safe. One of them is wear a 0 number glasses so that you can be safe. Thanks for watching, and for all the other news and analysis, this is your destination, News 9 Live.
He thought he could outlast us. And 1 year later, the evidence is right here in this room.
Who will blink first?
So far from preventing the expansion of NATO, Russian actions have actually resulted in the expansion of NATO.
It's a mess for Russia and it's a mess for the Western world, for NATO and the United States.
Putin is a dictator, and if he loses, that means the end of his regime, and probably of him personally. So he has to keep going.
Year 2. No end in sight. Streaming now.
Hello and a very warm welcome. You're watching News 9 Live. I'm Kabir Naqvi. Joining me here in the studio is my colleague and editor for News 9 Plus, Sandeep Unnithan. And what you can read behind us, swarm drones, China's new war machines, is going to be our focus over the next couple of minutes. Swarm drones, an emerging technology with far-reaching implications. As drones become a defining feature of modern warfare, it's crucial to understand the capabilities and the potential applications of these autonomous aerial groups. Now, drone swarms equipped with advanced artificial intelligence can work in unison to accomplish diverse tasks, from reconnaissance to targeted attacks. In this particular report today, we're going to try and delve into the features, the applications, and how they might impact amphibious operations. As technology evolves, reconnaissance and security, followed by light attack, are expected to be initial applications. However, the potential for mass attacks and overwhelming targets makes drone swarms highly effective for amphibious assaults. Stay tuned and get down in the comment sections as we try and explore the military value of drone swarms and what it means in the Indian context. How ready is India to counter this evolving technology? Our borders, how secure are they? These drones with the killer bee kind of an operation and mindset mentality, are we ready even as technology turns a new leaf? Are our defense capabilities up to the mark? We'll talk about all of this. I'm going to continuously pick Sandeep's brain here in the studio. But at the same time, we put out a documentary on the same topic, News 9 Plus application. Do download it. It's available on the Google Play Store, on the Apple iOS software, as well on your television, your mobiles, you name it, you've got it. Take a look at this snippet of the documentary that we've produced, and we'll come back for more. Understand what we're essentially talking about. I'm sure this will intrigue and interest you as well.
When we talk about a drone swarm, it's a collection of multiple drones that talk to each other, communicate with each other, and coordinate with each other to perform a complex mission.
There is a threat, no doubt about that. This is the latest one, more dangerous because the man in the loop is the least, but the destruction at the target end is massive.
Armed forces are more geared up to pick up larger aviation targets and the faster aviation target. Now this necessitated that we had to develop systems which could even detect small, slow, low-flying drones. Now it's a new threat.
I would like to think that we are prepared, but we are not, because nobody is.
The Russia-Ukraine war marks the world's first widespread use of combat drones by both sides. Drones are now as ubiquitous as artillery shells. They're being used for surveillance, reconnaissance, attacking the enemy, and in some cases even attacking other drones. Now, from this war, we know there are essentially two technologies likely to dominate drone warfare. The first is the capability to overwhelm your adversary with massed drone attacks. And the second, the ability to shoot down enemy drones. China is closely observing these advances in drone warfare, and in fact, it's been field testing military drones throughout their 3-year border standoff with India. Now imagine drones operating in groups of hundreds or even thousands, networked with artificial intelligence and guided by onboard sensors. They are like swarms of explosive-laden killer bees. These are called drone swarms.
Collective use of a number of drones. These are unmanned autonomous drones with different payloads as per the mission. And collectively they are used using a lot of technology, artificial intelligence, their interconnectivity, the ability to take decisions. So it's a very mission focused use of this latest technology and military hardware. I think this is a game changer for things to come.
It can fly very close to the ground and therefore it is very difficult to detect. If detected, you will be detecting them at a very short range. Basically, the enemy will have seconds or a few minutes to react, and that is what makes it very effective.
They pose among the biggest challenges for air defense planners. The Indian armed forces are worried about this threat along their northern borders, and in fact they've asked for high power microwave weapons to counter this threat.
Yes, of course, there is a threat, no doubt about that. A single person like a police station is controlling a swarm of drones. But these kamikaze kind of end result can cause a lot of destruction, whether it is to disable your air defense systems or whether it can be used even at a critical portion of your territory. These can be used in maritime warfare also. These can be used over ships. Your ship's air defense can be nullified.
The best radars won't be able to track a large number of drones flying at low altitudes. And once you arrive, you cannot counter them with the traditional means, the traditional kinetic means, wherein you have a gun or a fixed position. And there are drones which can go radio silent. There are drones which do not emit anything. So you cannot detect them by passive means. You cannot detect them by just listening to telemetry. There are drones which can navigate without GPS.
In September 2020, a Chinese company set a world record for a drone swarm using 3,051 drones. This record was broken in China again when 3,281 drones swarmed together in March 2021. This is the threat that China's mastery of drone swarms poses to India.
Chinese in the last 4-5 years have demonstrated large number of civilian drone swarms. But it doesn't mean they were not working on military drone swarms. So they were working on military drone swarms. End of 2020, Chinese demonstrated or rather released a video where a swarm of quadcopter drones were supplying food to their soldiers in the Galwan area. Now what the implied impact or message was, we have a swarm capability.
There is a lot of research and development which is going on, and whatever is available in the inventory of China can obviously be used against India. What one has noticed is not swarm drones, but one obviously has seen drones being utilized, and we also use drones. So that is the fastest, cheapest and lowest level available reconnaissance element. China puts its benchmark to USA. So obviously it is much faster than us, and it will definitely be ahead of us. That is one part. The second thing is the friendship between China and Pakistan. Because of the China factor, they always have an advantage.
Pakistan has been developing drones for about 2 decades plus. Did develop UCAB, they developed target drones, they developed swarm drones by their public and the private sector companies.
When India decided to open up and incentivize the defense production sector to private sector. That is the speed that we gained. Otherwise, earlier what used to happen, we were totally dependent only on government sector.
Indian Air Force had taken an initiative on 8th October 2018 when they launched Meher Baba song competition. So it was a pragmatic first initiative of independent India where we, Indian Air Force decided to develop a emerging and a futuristic technology. It was a big challenge. About 50 drones had to be developed which could undertake humanitarian assistance and disaster relief operations.
A Bengaluru-based startup recently delivered swarm drones to the Indian Army. These are among the world's first operational, high-density military swarming drones. This 100-drone swarm can hit targets at least 50 kilometers inside enemy territory. But India has a lot of catching up to do.
There are different types of architectures. So in both the architectures, there is a different way of handling the failure of a drone. There are some architectures in which there is a leader follower. Let's say in architecture 1, when the leader fails, the swarm together appoints another leader, and that single leader then is the leader of the other drones. In another architecture, everyone is talking to each other and coordinating about the main objective.
Armed forces are more geared up to pick up larger aviation targets and the faster aviation target. Now this necessitated that we had to develop systems which could even detect small, slow, low-flying drones.
One of the key components of a counter-drone system is microwaves, lasers and EMP systems. Of course, these are high-power systems and they can be very effective for swarm drone technology, but they still need to be tested exhaustively.
Initially, the requirement of these jammers was huge. The size, the bulk was huge. Now, cyber also comes into that. So, there are multiple solutions, and these multiple solutions will work under different types of drones.
So when we talk about anti-drone technology, we have people who are working on ASR radars, which are very effective radar technologies being used to detect drones that are not having radio signature. We have people who are also working on RF-based detection technologies. We have people who are also working on EO/IR-based technologies. And then we also have startups and other large sector enterprises which are working on integrating various types of micro missiles and light and medium machine guns, as well as lasers, to ensure that the input from these sensors that is being used to detect can be used to align the different types of countering weapons and destroy the drones that are going to be potentially there in the air.
Till now, nobody has deployed a swarm of drones in a battlefield scenario, though everybody is gearing up for it. I would like to think that we are prepared, but we are not, because nobody is.
Well, so that's the documentary. You can catch it on the News9 Plus application. If you haven't downloaded it already, I seriously suggest and implore all the viewers to definitely go and do that. You know, Sandeep, the documentary ends on a very ominous note. You know, you've got the talking head over there saying that he'd like to believe that we're prepared, but we're actually not. What's the situation right now? And for people out there who don't necessarily know what are swarm drones, can you throw some light a little bit on the swarm drones? Because drone technology, I remember, you know, Aviation Ministry last year around had put out a massive circular, a gazette notification, talking about the size of drone, what drone you can fly in which area, what's a green area, what's a red area. And with drones, I mean, from food delivery to animation to, you know, holographics, all the good things have also come, but with the good things, I'm sure there are lots of negatives as well. So throw some light on that.
Yeah, absolutely. Thanks, Kabir. Good to be back here with you again. And firstly, that story, that amazing story was put together by a reporter, Nivriti Mohan. She's just done a lot of legwork on that, and she's got some really exclusive insights into our drone preparedness and in fact what the Army, the kind of technologies that they're looking for. Now, coming back to your question about swarm drones, you know, last year we had that conversation about what is the future of warfare going to be, and everyone said it's going to be drones, right? That was a year ago. Today we are in the middle of the world's first drone-on-drone warfare where both sides are deploying drones, right, attacking each other, Russia and Ukraine. There was that report, I don't know if you saw that one, by Rusi, which says that Russia is shooting down 10,000 Ukrainian drones a month.
Right.
I mean, that's an incredible volume of drones, and that just tells you how warfare has so completely changed in the last 1 year since we had that conversation. And today, it's no more a matter of will drones be used in warfare, it's how they're going to be used in warfare. So this is, our story here looks at the future of drone warfare, and the future, clearly the phase 2 is going to be swarm drones. So what you had now, all the stories up to now, all the videos that we've seen are of individual drones being sent out,
Singular.
like missiles, singular, or in launched in salvos, right, to overwhelm a target. But now we are looking at the second phase of this, where you have network drones, that drones that are talking to each other and they're assigning targets. They're almost independent, autonomous, and they're overwhelming a target, sheer numbers, exactly like killer bees. They go there, they pick their targets, allocate it, and then they start hitting these targets. And the drones are of all sizes. The swarms that we could be faced with, palm-sized drones, they could be larger quadcopters. This is a technology that every country in the world today, every country that has a decent sized military is looking to develop, and they're also simultaneously looking at counter drone technologies. So our story basically looks at this threat that's posed on our borders, both our borders in fact. We have a two-front war situation with Pakistan and China, as the military calls it, but with drones now coming into the fray, we're looking at a two-front drone threat as well. Now, on the western border with Pakistan, you have this thing of drone drug mules being used as drug mules. Literally every day there are weapons and arms and ammunition and drug shipments
across the Punjab border.
Across the Punjab border, exactly.
Had them drop the various parts of an RPG launcher.
So that's how it's almost like a daily occurrence in Punjab now. So we've had brilliant ground reports from Punjab as well. Along the China border, very interestingly, what's been going on in the last 3 years, ever since the deployment in Ladakh began and our counter deployment against the Chinese, is that it's being used as some kind of a proving ground by the Chinese to test a whole lot of drone technology, especially in high altitudes, right? So we've been seeing our positions being buzzed by drones, and which is why the Indian armed forces have kind of accelerated their requirements. They've accelerated their drone acquisition programs and indeed their counter drone programs. So there's a massive amount of research that's going on even as we speak in laboratories across the country. There are lots of people who are putting their heads and minds to this kind of threat, and we're hearing reports of swarm drones already being deployed by the Chinese against us. I mean, these are unconfirmed reports of sightings of swarm drones along the line of actual control. And while we haven't been able to confirm those reports, what we do know for a fact is that a few months back, the Indian Army issued a white paper to the Indian industry, a problem statement asking them for a range of counter drone technologies, a range of counter swarm drone technologies. And that's what you saw in that document.
Essentially means that we do have a problem at our hands.
We do have a problem, right? We have the problem on both fronts, and the China border is actually more worrisome simply because of the kind of capabilities that the Chinese military and their commercial space have been able to master. Chiefly the ability to fly very large number of swarms together, 3,000, you saw it there, right? Those demos with 3,000 and 5,000 drones. I mean, it's incredible to move this mass of drones together. Now the military application is just a step away from that.